The button.
Hello, my name is Trenton Ellis. Can you tell me your name, please?
Wes Ellis.
Where are you today?
I am Chris River, Florida.
Okay, do you know the date?
Yes, it's the 22nd of April.
I now know that you have appropriate speech by the way you answered me. I can see that you take care of yourself for personal hygiene, and your posture seems to be okay. We're going to move on to a sensation for your face. So would you close your eyes for me? And tell me where I touch you.
Forehead, nose, chin,
Specifically what side of...
left, right.
Okay, and go ahead and open your eyes for me. I want you to look off into the distance. And then look through my finger. See good pupil dilation. Check the eyes for secretions, inflammation, redness, or swelling, which is none. And check the nose for symmetry. It's perfectly straight. Each side is the same side. Do you hold one finger over your nostril and sniff for me on each side? That means that there's no obstructions in your nasal canal, anything like that. So let's move on to your mouth. If you open your mouth for me. Okay. There's no inflammation or redness of the mouth at all. No signs of inflammation of the gingia. No abnormalities. Your tongue is light pink. It's not red or anything like that. I'm going to go to your ears to check if there is any swelling, obstructions, lesions even. And I'm going to do what it's called, which it's fine. There's nothing clean. Good ear. I'm going to do a whisper test. You're going to repeat back to me what I tell you so I know you can hear me.
Shoestring. Wash rag.
Okay. And now that that's done, we'll go through to your thorax and lung assessment. And first I have to do a 2-to-1 assessment to where you're equally on this side as you are doubled to the front, which is true. I need to look for an abnormal respiration rate, any coughing in your breathing, any obstructions in your airway, anything that'll cause you to have difficulty breathing, which it doesn't seem like you do have any difficult breathing. So now we're going to move on to the lung assessment part, to where you listen to your lungs, how they are. The first 6 sides, anterior. Go to top left first. Take a deep breath when I put the stethoscope on. Posterior. Alright, 2 auxiliary capillaries. Okay, seems fine. I'm going to check your carotid arteries. Making sure not to do both at the same time to block blood from the brain. Starting from left, using the pads of my fingers, which is there, which is there. We're going to assess your heart auscultation. Starting from aortic, listen to your heart, see how it sounds. This is pulmonic. This is Erb's point. Let's try tricuspid. This is mitral. That seems to be fine. Now we're going to go to the GI. So would you lay down for me, please? Assess the curvature of the abdomen, which is flat, normal. Now we're going to auscultate all four quadrants, starting from the bottom left portion. For bowel sounds, should appear 5 to 15 seconds. And an absence of a vowel sound is a negative thing. Okay. Very easily heard. I go to palpating it. Tell me if you feel any pain, tenderness, any rebound. Rebound is when I take my hands off and pressure is gone, then you feel the pain. Lightly. Feel any pain, just let me know. 4 different areas. Nothing. What are your urinary and bowel habits?
A couple times a day, and then pee as needed.
Alright, any problems with them?
Nope.
No? When was the last time you did a bowel movement or a void?
About 4 hours ago, I peed, an hour ago.
Going to sit up for me, please. We're going to check for edema. Okay, you see your arms. Your arm should have good elasticity. Not completely like sink in like a memory foam mattress. And that's also on a scale. This is a 2, which is normal. No swelling, pain, temperature seems normal. It doesn't hurt or anything like that. No tenderness. Okay. And then we're going to go to the capillary beds on your fingers. Substantial amount of pressure, not too much though. It should return the blood 2 to 3 seconds if normal, which it did in 2.5 seconds. And now we're going to go to symmetry of the muscle and size. You have adult size muscle, and it's symmetrical to your body in proportion to each side of the body. And we're going to do movements of your neck, upper and lower extremities. So if you could just go left to right with your neck, back to forward. Any restrictions or anything, any pain?
No.
Same with the arms. Can you pull them straight out for me? Come them in like a football goal. Pull them straight back out, forward. Flip them over, flip them back. No restrictions whatsoever. And same with your legs. Stick them straight out. Roll your feet. Bend them up and down from your knee, back and forth. Side to side, crisscrossed. Seems to be okay. Gotta do muscle strength. Now you're going to resist my pull. So give me your arms. Put them straight out in front of you. Now resist. When I push up, you just don't let me move. Okay? Now flip them over. Alright. Curve them up like this. Try to pull and hold it there. Okay? Same thing on your legs here. Try to resist. I'm going to push down and you just don't let me push them. Okay? Same thing again. Alright. Good muscle strength. Now we're going to assess the pulses. Radial first for symmetry and strength. Using the pads of my fingers. assess. They are symmetrical, and they're about a 2, and from the 1 to 4 scale, which is normal, go to brachial. So, as you already can tell, about a 3. There seems like you've just been working out, huh? Right. I'm gonna go to dorsal, posterior tibula on each side. Make sure that's symmetrical. They are. It's about a 2 in normal range. Now dorsal pedis, each side, top of the feet. Relax them for me. All right. Symmetrically the same. I need you to stand up for me. I need to check your posture and gait if you walk around the side and walk back. To make it more comfortable than you already are. Doctor should be in a minute.
No, I'm good.
No? Alright. As I'm saying this, I'm washing my hands, cleaning them. I exit the room. I go to exit the room to document what I find.
Push the button.